Hi, I'm John Donnelly, CEO of JMS Healthcare Partners and the Technical Director of the New Jersey Healthcare Innovation Center, which is a unique concept that has been established in New Jersey as a way to facilitate the programs of innovation and health information exchange as we look to move the healthcare ecosystem from its current environment and current paradigm to one that is a little more interoperable, a little more consumer focused in terms of its information content and exchange. So today we're going to just talk briefly about how we got established as the Innovation Center and what it looks to do as an integral part of New Jersey's HIT program. Not too many months ago, this is actually the brainchild of Barnabas Health, the largest healthcare system in the state of New Jersey, and in collaboration with NJIT, a leading information technology university in the state of New Jersey. And the two powers there got together and said, well, how do we promote innovation and yet make it part of something that is a collaboration for the state. From that initial thought came the idea, well, we need to create a center or a series of centers of excellence that can facilitate the development of solutions so that we can take advantage of inventions and innovation from many of the smart minds in the state and work them into actual deliverable programs that healthcare provider organizations and healthcare stakeholders can deploy. So with that, we came with the idea that we needed, first of all, what kinds of centers of excellence do we want? So we said, let's put things first in terms of how do we get to solutions. So we created something called the Design and Collaboration Center as its first center of excellence. And this is where the brainstorming occurs, where stakeholders, primarily providers, that would come forward and say, here's my problem set. Here's things that we need to address. And now we pull the people together that know about the problem with people that could potentially solve that problem. Vendors or university, academia, healthcare informaticists, people that can help bring this to fruition. The second thing is, once the developers have taken on this problem and we've documented the objectives, then what we want to do is be able to simulate this, because most of these problems relate to interoperability. They have to do with multiple systems in multiple stakeholders in multiple environments. So what we wanted to do is be able to stand up a center, which we're calling the Simulation Center, which lets these problems actually be demonstrated. So if we take a problem and let's call it a use case, which is a common term that we use today in the healthcare transformation process, and we define that and state our problem there, we can then build an interoperable solution to address that. Okay? So given that we've succeeded with that and we're all happy with what happens in the simulation, now it's time to take it to the real world. And for that we need to have education and awareness and a program that then promotes the rollout of these solutions into real-world provider organizations and other stakeholder entities in the state. And that work will actually be done likely in collaboration with a newly founded entity in the healthcare system called the Regional Extension Center. Every state has one. New Jersey's is called High-Tech. And it is at the forefront of trying to facilitate and support the creation of electronic health record systems for purposes of interoperability in the interest of state priorities and federal priorities. And so the Education and Awareness Center, the third center of excellence of the Innovation Center, will be partnered and in collaboration with that that particular program, ensure that we get a rollout at a very efficient method of deployment, and also to leverage whatever programs that are established, so we don't reinvent the wheel and start from scratch for some of these things. Okay, so so now we see we have 3 centers. So how do we get it engaged? How do we start it? One thing is that we want to look at the state's priorities, and the state's priorities are defined as use cases, and for that we are going to then use the centers of excellence to establish the solutions and then simulate those solutions. And so that's the round 1. We're looking to begin this program in this calendar year, and we have done some proof of concept things here at the Innovation Center already, and as a result we're pretty comfortable with the idea. So that's the game plan. Watch as we move forward. Look for more marketing and announcements about the Innovation Center program, and we will welcome all to be part of our family of solution providers, and look to be working with you in the not too distant future. Okay. Hi, my name is John Donnelly, and I'm one of the managers of this interoperability demo that you're about to see today, and we'd like to talk a few minutes about what you're able to see here and how it's relevant to your real-world healthcare processes. You will have an opportunity to see a use case which we feel is very appropriate to healthcare. It talks about an emergency encounter. It talks about information that is collected during that encounter, and then beginning a process of information sharing across multiple communities. And I think the real value here is that this is a little microcosm of what we anticipate to be happening in the state and across the state's healthcare communities. So you will see a couple of teams. We have a total of 4 health information exchange entities, and we have their member entities, which are could be a hospital system, it could be a doctor's office. In one of them we actually have an ambulance service, and a nursing service for home care. So I think you'll be quite amazed at what they're able to do in terms of exchanging healthcare information across those boundaries, all in the interest of a more efficient and a higher quality care delivery to the patient. At the end of each story, we also will be highlighting some patient engagement. We'll show how the patient can step up and actually see what's going on so that they can participate as they see appropriate for this exchange paradigm. So we hope that you get a chance to come in, see one or both of the tours, and then spend some time with the vendors who have spent tremendous amount of time here in gathering their technical resources together, to pull this off. And my compliments to them. We all recognize that this is a partnering effort to achieve this. And the good news is that HIMSS National is also doing something similar. We have a HIMSS interoperability showcase there, which I'm the technical project manager for that. And this is a little snippet of what you are able to see at HIMSS National. So HIMSS in general is a big supporter and sponsor of these programs, and hope you get an opportunity to walk through and ask questions and enjoy yourself.